With the recent outbreaks of Nipah and Corona, the whole world of bacteria and viruses has us terrified. But here we have an expert microbiologist who will help us keep all those scary microbes at bay by imparting her immense knowledge to us. Introducing Dr. Devasena ma'am, Head of Department of Microbiology, ICH, to speak about newer microbes.
So, good evening all. It's going to be a totally different session after hearing your biochemistry session. So, newer microbes, I know what you are going to expect. We have So, we have plenty of bacterial infections, fungal infections and viral infections, which we can call as emerging and re-emerging infections. But still, why do we give so much of importance for viral infections, because they are very harmful, and though they are easy to diagnose, they spread very fast and their after effects are also really harmful. But why do we get scared of these new microbes? Because we don't have proper treatment or vaccination, and they are emerging and re-emerging. Not everything is always new. They were present earlier, but we still feel they are newer. So why should we feel like that? Because they mutate, and there are a lot of factors: environmental, host, and this thing, actually human system itself changes. So there are a lot of underlying factors which mutate, and we also have so many other comorbid conditions which help in the progression of the disease. So when we talk about the newer bacterial diseases, we are not that much affected. Of course, there were a lot of bacteria like Pseudomonas pseudomallei and Burkholderia cepacia, and plenty of strains of E. coli that were quite harmful, and they were also mostly treatable, but the complications were much also. But when it comes to fungus, there are so many Candida species. It has shifted from Candida albicans to Candida non-albicans species like Candida krusei and Candida Gulielmandi and Candida auris. So they are also very harmful. But still, viral infections, like recently last year we were so much worried about Nipah, and the previous year in 2015 and 16 we were worried about Zika, and earlier we were worried about H1N1. Now also still H1N1 pandemic is still persistent, but still we know that is very harmful, and we have vaccines for that. And the complications are also plenty, and every time we discover newer tests and newer vaccines. So that is the importance of newly emerging infections. And latest, when we talk about coronavirus, you'll come to know that we need not fear so much about corona compared to all the other newly emerging viral infections in the recent past. So let's go into detail. So introduction to this newly emerging bacterial infections, viral and fungal. But today why I want to speak only about viral infections is such because I have only 20 minutes time, and much of the bacterial and fungal infections are not as dangerous and as threatening as these viral infections. An emerging infectious disease is the one that is caused by newly identified pathogen which has emerged and whose incidence in humans has increased during the last 2 decades. Yes, in 80s and 90s, what was the threatening pandemic? It was only HIV and AIDS. So HIV virus was the most dangerous pandemic virus, and it was an emerging virus. And now, in later 90s and in 2003, SARS was very dangerous. The severe acute respiratory syndrome virus, it belonged to the corona group in 2003. And in 2013, it is MERS. So Middle East Respiratory Syndrome virus. So all these things, they did cause panic, but I think India was not much affected by that. But worldwide, there were several countries which was affected. But still we have vaccine. Again, then swine flu and avian flu were a little bit life-threatening. And then you still have vaccine for that, but which lasts only for 6 months. So emerging diseases include the HIV infection, the SARS, the Lyme's disease that is caused by Borrelia burgdorferi, and Escherichia coli, there are plenty of strains, the Hanta virus, Manchurian syndrome, dengue fever because of various strains, and West Nile virus, Ebola, and Ebola also caused panic in 17 and 18. And then suddenly it vanished, and the African countries were affected. Then Crimean Congo hemorrhagic fever, even now it's an emerging infection. It goes unnoticed and unnoticed, and that is again life-threatening. And Nipah, fruit bats, they were quite popularly spreading that. And Zika virus, when there was microcephaly in Brazil, and there were infant deaths and fetal deaths, that was caused by just Aedes aegypticus, which also spreads dengue and chikungunya. And the coronavirus, we call it by several names now, COVID-19 and SARS-CoV-2. And coronavirus has got plenty of groups in that, the beta alpha coronavirus, beta coronavirus, the SARS and the MERS and the COVID-19. But the alpha coronavirus just caused upper respiratory tract infection and the symptoms were not very life threatening. But then the beta coronavirus, the SARS and the MERS, yeah, it was very dangerous. And the COVID-19 initially it only started symptoms with upper respiratory tract infection symptoms, but then it got, it infected the kidneys. Not only the lung parenchyma was invaded, but the renal parenchyma also was invaded and the liver also was affected. So it was on December 31st, 2019, this virus was found to be affecting the Chinese Wuhan people. So then we called it as coronavirus and COVID-19. That's why it was named like that. And the epidemiological triad of the disease, basically this is for upcoming or emerging and re-emerging infection. The host, agent, vector and the environment factors contribute to that. And factors contributing to the emergence of infectious disease, again this description: agent, evaluation of pathogenic infectious agents, adaptation and change, development of resistance to drugs, non-adherence by patients and use of anti-infective drugs. This can be for both bacterial and viral. And factors contributing to the emergence of infectious disease: host, human demographic change, inhabiting new areas, human behavior, that unsafe sexual practices was denoted for HIV, changes in agriculture and food production patterns, that was for E. coli emerging infection, increased international travel, influenza, this H1N1, then H5N1, then H3N2, so now we have H7N1 also. So you keep producing vaccines for this, but then it doesn't, if there is a vaccine for H1N1, it doesn't answer your H5N1 infection or H3N2 or H7N1 or something. So it goes on mutating. So that is more dangerous because of the severe respiratory distress. And still we feel now, we talk so much about the corona. More than the virus, the WhatsApp status and the Facebook, that has gone viral more than the coronavirus. You know, that is very dangerous in the comorbid condition. So the comorbid factors of the host is also important. That's why I'm talking that under this heading. Human susceptibility to infection. Basically, if your immunity is good, no virus can threaten, no emerging and re-emerging virus infection is going to harm you. So immunosuppression is a basic thing, and poverty and social inequality because of bad safety hygiene practices. So factors contributing to the emergence of infectious disease: environmental, climate and changing ecosystems, deforestation. So we talk about bats, and most of these viral infections, the bats have been a good source. So there are zoonotic viral infections which are emerging and re-emerging, and the global warming. So these are the contributor factors from environment. So we are worried about the Crimean Congo hemorrhagic fever, and that is also an emerging infection. It might become very popular in the upcoming days also. So it's caused by a tick-borne virus, norovirus, and these most of these emerging and re-emerging infections, they belong to the arbovirus group. And the disease was first characterized in the Crimea in 1944. So they were existing, but then now they are re-emerging. So this is how it's been spread from birds and large vertebrates. So it's a zoonotic viral infection, zoonotic viral emerging infection, transmission of Crimean Congo hemorrhagic fever. This too affects the lungs and the kidneys, and there can also be present in large nymphs and small vertebrates, and you can see the livestock, and always camels and grazing cows have been there as a source of infection. So human contact can spread the disease. So Crimean Congo hemorrhagic fever can be transmitted from one infected human. So I am talking about the 5 major emerging infections: Crimean Congo hemorrhagic fever, the Zika, Nipah, Ebola and the coronavirus. So CCHF can be spread through blood or body fluids, and documented spread of Crimean Congo hemorrhagic fever has also occurred in hospitals due to improper sterilization of medical equipment, reuse of the injection needles and contamination of medical supplies. So always this need not be through the tick-borne, it can spread through fomites and it can spread through animals and unhygienic practices. And who are at risk? People at most risk for CCHF include livestock workers, people who herd animals, and people who work in slaughterhouses and in the endemic areas. So these are all pandemic. So we always talk about endemic, epidemic, but unfortunately, whenever there's emerging and re-emerging infection, it is pandemic most of the time. The disease starts with short incubation period, is very short, 3 to 7 days, but the hemorrhagic fever lasts for 3 to 6 days following the clinical signs. So how is Crimean Congo hemorrhagic fever diagnosed? So all these diagnoses, viral antigen tissue by immunohistochemical staining and microscopic examination. So your Ebola virus, it caused panic it started from Africa, then it started spreading to some countries, but it was very dangerous. Okay, 90% of the patient who had contracted this Ebola virus infection, they landed up in death only, so there was severe mortality. Ebola was first discovered in 1976 near the Ebola River, now the Democratic Republic of the Congo. It's a single stranded RNA virus as animal borne, and that bats are the most likely reservoir. So wherever possible, your bats are being the reservoirs. So even so, in Ebola, the importance of epidemic lies in each outbreak hospital staff becomes infected through close contact. So Ebola was highly infectious, and you would have seen how they prevented by wearing all the personal protective equipments as though they were walking in the space with all those N95 masks, and they had the gowns, and they had they had gloves, and they had the boots, and they're fully covered, and their secretions were in fact buried as though they were very harmful, and they were all incinerated. Dead bodies of Ebola virus patients were incinerated. So such was the severity of the infection, but somehow it was contained to most of the African countries. The mean time of death from onset to symptoms was almost only 1 week. So again, laboratory testing, the serological test was ELISA, and the antigen capture detection test for the serum neutralization test is always RT-PCR is available for the antigen detection, and electron microscope, and viral isolation only theoretical, takes a longer time. So again, Nipah virus, last year we were talking about Nipah virus was spread by fruit bats, and it was in Kerala, and almost many countries of the world were affected simultaneously, but in India, we remember it was originating from Kerala, and many patients were affected by Nipah virus. How this coronavirus is causing a dangerous threat, Nipah was in fact more dangerous, and it was again by consuming the fruits eaten by infected bats and birds. So natural hosts were fruit bats, and pigs were also the reservoir hosts. Though contact with other infected people, that human to human transmission also was very rare, but then it was only through fruit bats. So these were the symptoms, which was very in the recent past, the beginning of 2019 and the end of 2018, everybody was scared about the Nipah virus infection. So normally fever, headache, drowsiness, disorientation, mental confusion, coma, and death were the things. Though few people were affected, at least 60% of them were, they had mortality. So Nipah diagnosis needs serological and molecular testing methods. So they had many centers which are performing the RT-PCR and the ELISA methods to detect the Nipah viral infection. So again, how to avoid? We can't say the Nipah virus infection is fully gone just because you are not getting a cases these days, but it might again emerge. Anytime it can emerge, it's not fully gone. So how to prevent Nipah virus infection? Avoid contact with infected people, animals such as pigs and fruit bats. Maintain personal hygiene always, as hand washing techniques are important. Do not consume the raw fruits. Use personal protective equipments like goggles and N95 masks if you come across a Nipah viral patient. So Zika was also a big RNA virus spread by Aedes aegypticus mosquito. Apart from your dengue and chikungunya, it also spreads yellow fever and Zika, the Aedes aegypticus I am talking about. So it was transmitted by daytime active Aedes aegypticus mosquitoes and Aedes albopictus. So this is how it spread. There is no treatment or vaccine available, but Zika virus caused lot of microcephaly it caused in newborn patients. It was they had microcephaly or fetal death. So pregnant mothers were affected by Zika virus, especially in Brazil. So they thought they might be affected in India also. They were scared, and those born to mothers infected with the Zika virus, they showed features of microcephaly. That was a big botheration then. So key facts to know: people with Zika virus disease usually have a mild fever, skin rash, and conjunctivitis. We'll never know when the Zika virus is going to emerge again. There is no specific treatment or vaccine currently available. The best form of prevention is protection against mosquito bites. That's the thing. So So complications of Zika virus, as I told you, fetal microcephaly, Guillain-Barré syndrome, and intracranial calcifications. So again we have RT-PCR to test the Zika virus infection and IgM ELISA. The swine flu has always been a threat because of the various hemagglutinin and neutralization spikes on them, and various combination, the antigenic drift and antigenic swift of the influenza virus causes the different strains to cause the disease each time. Earlier it was avian flu, and then it was H3N2 and H7N1, but H1N1 had a longer stay, and many had this acute respiratory distress syndrome and they passed away because of the severe respiratory infection, and it is contagious and spreads from human to human through cough and sneezing. So you always have to practice proper cough etiquette also. So prevention is the best option, and of course you have flu shots for H1N1. So, but it lasts only for 6 months, and only for H1N1 you have, and if you develop a flu shot for H3N2, again there is a variant, H5N1 can cause the infection. So, you do not have complete protection, but when you have that seasonal thing and if you have that vaccine availability, you might as well take. So, these are the symptoms for swine flu, like any other severe respiratory infection, starting from running nose and sore throat. They had shown a few GIT symptoms also. So, specimens, the same way how we are going to collect for coronavirus, we had the nasopharyngeal swab, nasal aspirate, and then the combined ones, and the intubated patients, the endotracheal aspirate and bronchial lavage was helpful. So, these are the important lab investigations. So, we have come to our important COVID-19. So, this is also called by the other name as SARS-CoV-2. So, the SARS was earlier spread by the civet cats in 2003, and MERS was spread by bats, and it was spread by camels, and it was in 2013. Whereas COVID-19, we thought it is again spread through bats and uncooked meat, like especially snakes and whatever they consumed raw in China, and fish and all those things. They had the seafood market, and initially they said that was the reason of spread, and then human to human transmission it started. It started as a zoonotic disease, and then it spread from one human to other. So, it also became like human transmission is also possible, though basically it was found to be a zoonotic one. So, the strains like 229E and NL63 and OC43, those things were a little bit mild, but the other beta coronavirus HKU1, MERS-CoV, and that was which caused the Middle East respiratory syndrome, and the SARS-CoV has shown severe mortality and morbidity in those patients, mortality especially. So, sorry, this slide has come. So, coronavirus, you have the upper respiratory tract infection, mild infection to severe infection causing severe respiratory distress, along with your renal parenchyma getting affected, causing renal failure also. So, the virus enters to nose and mouth, then finds the host cell in the respiratory system. The host cell then bursts, and this is a normal how the viral cycle is that. How it spreads, so it has to spread from humans to humans and to humans from an animal, though it thought was, initially they thought it was to the snakes and then the bats. So, how it can kill? Most victims of the virus die from complications including pneumonia and swelling in the lungs. So, they had seen a cluster of pneumonia cases in Wuhan city of China, then they thought it was initially because of H1N1, then they found it was due to this coronavirus. And then apart from this pneumonia, cluster of pneumonia, they had also had these patients going in for renal failure just within 3 to 4 days of coronavirus infection. So, that way they couldn't retry them. So, this coronavirus always has symptoms of cough, fever and pneumonia, like all the features of pneumonia, rapid breathing and shortness of breath, but they also showed the GIT symptoms like vomiting and diarrhea plus a renal failure. So, it is a large group of virus which can infect both humans and animals with cold related diseases, and there is no vaccine, but right now there are a lot of news happening. They had discovered a vaccine in Australia, in America and here and there, but exactly the vaccine is not there. better for coronavirus prevention is better than cure. You should always have, you know, that cough etiquette and don't spit, and the surfaces, the coronavirus stays for a longer time on a surface, so the surfaces should be clean if at all you suspect some person has coughed on the thing. But then this coronavirus usually affects the elders. It doesn't, I mean, so far there is no coronavirus cases or deaths in children, they are not affected with coronavirus. It's adults between 45 to 80 years, and those who have comorbid conditions, or those who are on anti-malignant drugs, or those who are and they are immunosuppressed, or if they are severely diabetic, or they are having high hypertension and other comorbid conditions, with those patients, or renal transplant patients, or heart and lung transplant patients, or basically some other comorbid conditions, those patients are affected with the coronavirus. So this SARS-CoV-2, this is the virus name of this virus. This has unique pathogenesis because it causes both upper and lower respiratory tract infections and all the other symptoms I said. So how is novel coronavirus transmitted? The cluster of cases seen so far has been transmitted between family members, because that's why they prefer home quarantine. When you suspect this coronavirus in a patient and you make them travel from home to the hospital, and you might spread the viral infection on your way, and the doctors who are treating them can get this, the other home members can be affected also. So better to have a home quarantine, they can be isolated and they can be kept under observation. And as such, you do not have any anti-corona drugs, but then they said lopinavir and ritonavir were useful for some patients, and alfinavir, and so these drugs were used against HIV. Actually, those drugs which were used to treat HIV is now useful to treat coronavirus, because they developed, by mutation, they developed the glycoprotein spikes on them. So these got destroyed when this lopinavir and ritonavir along with oseltamivir was given, along with interferons. They found it was, those patients got cured because of this antiretroviral drugs. So it was really shocking why this coronavirus was, you know, like over covered with the structures of HIV. So that was the mutation of the virus that has taken place. Okay, these are the symptoms and preventive measures. Again, I repeat, prevention is better than cure. So keep away from someone with a heavy cough. Use a tissue to cover the nose or mouth while coughing, sneezing, wiping and blowing the noses. If a tissue is not the best thing is you use the elbow, interior aspect of the elbow to cough or sneeze. Wash hands with hot water and soap at least 6 to 7 times. Disinfect the common surfaces and frequently as possible, as frequently as possible. The door knobs and the railings of the escalator, all these things can also spread this coronavirus. So better not to touch them if you are in a crowded place or so, or wash your hands immediately, and do not touch your face after touching these surfaces. So the lab diagnosis is very important. So nasopharyngeal swab collection and the bronchial lavage, endotracheal tube, aspirate, these are the specimen times. This is given by our standard NIV Pune. So National Institute of Virology Pune, they have decided this, and that's an important center, testing center. But now in Chennai, we have King Institute of Preventive Medicine as a testing center. You can always report, if the suspected case, you can always inform the microbiologist. We'll come and collect the samples. We'll transport also in the viral transport media, and the Dacron mesh is used as a nasopharyngeal swab material. So all these things we have, every hospital has got in their microbiology department, they are well equipped with this, and you can always transfer. King Institute is in Chennai, is the testing center for us. So what they do, they run the RT-PCR for the swabs, and the result is given within 24 hours. That is the most important thing which you have done. And you know, all these thermal scanners in airports and all you heard of, which screens for the temperature of the person. So any history of travel to China, Japan, Korea, now Italy, and in India those Italians had come to Rajasthan. So all these cases were reported positive, and mind you, out of 90% of them they recovered. Only there was no morbidity in India. I mean, there was no death in India, but there were so many deaths in China. So tests to be performed, these are the things Because these are the main things you have to know: the nasopharyngeal swab, the oropharyngeal swab, the endotracheal aspirate are the specimens, are the ball samples, and the sputum samples are the important ones. You can send it immediately, or if you want to store, you have to store it in -20 degrees centigrade, but not later than 48 hours. And this is the form you had to write about the, apart from the name of the patient, the exposure history, travel history, the symptoms, and the treatment. Any treatment, I mean, the case definition is also very important. So you have to say yes or no. So severe acute respiratory illness, history of fever, cough, requiring admission. So these were the type of similar forms we had for H1N1 also, but we have a little elaborate form. The history of travel to the country is very important here. And this PCR test I told you, now they have, according to WHO scientists, Dr. Soumya Swaminathan, she has told ELISA tests are also there, but they have well equipped ELISA tests. I mean, they have the kit for that, but we don't have the kit for detecting coronavirus in our labs. Right now we don't have the ELISA kit, but we have only one center is there. We have identified like that VRDL centers, viral research and diagnostic laboratories all over India. Each state has got 1 or 2 centers. So these are the tests. PCR, RT-PCR is a very important test, but the results are given within 24 hours. So treatment, I said they are undergone a lot of trials regarding actual treatment. So initially the protease inhibitors, the antiretroviral drugs, lopinavir, ritonavir, they demonstrated a very good antiviral activity against severe coronavirus. So they came under the different combination called Alivia. So interferon alpha and interferon beta were also useful against this, and ribavirin was not useful, but they also had a combination of lopinavir and oseltamivir along with interferons. That was also useful to treat some patients of coronaviruses. So no handshake, no tapping, no high five. So all these things can spread the virus very easily. So our namaste is very useful. Hand washing is useful. So thank you for the patient listening. Thank you so much.